Hello, everyone. Thanks so much for joining me for the next 15 minutes. We're going to talk about the importance of math in your practice, and specifically how our seven-figure practice owners understand their lead math and optimize that for the best come-in results. So what we're going to cover today: vision. I want you to see your practice clearly and see everything inside your practice as an opportunity to be able to increase your revenue and increase the performance of your clinic. Marketing is a needed investment, and we're going to talk about the specific mindset that we want you to have for marketing, whether it's internal or external to your practice. Also, the importance of knowing your numbers. We're going to go over some numbers today that may not be tracked inside your practice right now, or may be tracked and need to be optimized for better performance. We also want to focus on the core metrics that you must track and understand in order to get to a seven-figure practice, and also how to scale your practice predictably, not just week to week or month to month, but year to year and beyond. New patient journey. We spend time almost on every one of these sessions focusing on this, and the goal is to attract the right types of patients, to engage them in a meaningful conversation, to convert them to a screening, appointment, or assessment, that consult where you're going to diagnose, build rapport, present your treatment plan, and then close that patient to a high ticket value treatment. Vision the senior numbers clearly. So we need to understand, what are we tracking and what are we not? Obviously, most practices track some basic metrics, but there's probably some metrics right now that we're going to talk about that you're not tracking and that you need to track them. And it's more than just the bank account result. Many of the practices that I consult with over the years of my career, one of the things I hear overwhelmingly is they say, we had more money in the account this month than we had the month prior, so therefore we had a successful month. That's not how we run a successful seven-figure practice. We want to understand the importance of tracking our ROI over different time periods so that we're always honing in on the best performance. And we also want to commit to understanding the cost per acquisition for new patients. That's going to be our most important outcome, not just in evaluating our marketing, but evaluating our team overall. So marketing is an investment. Successful marketing is an investment. It's not an expense. And it's not only a monetary investment. You're also improving your branding, improving the perception that you have within your marketplace with the specific avatar and customers that you're looking for. We also want to get better at engaging with our patients. We want to make sure that we're helping more patients in the community and that we're seen as the premier clinic in the market. We don't want to be the second, third, or fourth choice for patients. We always want to be the first choice and often the only choice that they're seeking when they're looking at specific outcomes. So what most practices don't know are some really important metrics that we're going to learn in this program on how to track. So specifically, referral volumes over the last 36 months. Have they gone up? Have they gone down? Have they been stable? Has there been a short-term trend? Has there been a long-term trend? Also, what's that referral turnaround time? Is it having an impact on generating new referrals for the practice? What are the current show rates from different mechanisms inside of the practice? So internal marketing, external marketing, even from referrals. And a case presentation rates. How many of the patients coming in are we actually presenting with cases? How many are we able to help and to treat? And finally, case acceptance rates, which is definitely the most important. Are they, again, moving up, moving down, staying static? All of this information is really vital for us to assess how the practice is performing. So the key metrics that we're going to look at in this program are the potential patient value, cost per lead, cost per show, cost per acquisition, and most importantly, in my opinion, patient lifetime value. And we're going to go through each of these in specifics. So potential patient value. The potential revenue generated from each lead. It means it's a new mindset for a lot of the practices where the patient has the potential to accept treatment. So that means a patient coming into a dental practice for Invisalign or implants or coming into the vein practice for a potential ablation is actually looked at as the potential value of the outcome of treatment for that patient each and every time that they come into the practice. And that's what we want to train our entire staff to have mindset on. It's not just a patient, but it's actually somebody that can contribute meaningfully to the financial performance of the clinic. So each and every lead that comes in needs our time, care, and attention. We need to be able to focus on creating that therapeutic relationship with them. And when we adopt this mindset, the patient experience actually changes in a positive way. So what we do is we end up focusing on all the little things. Is the waiting room cluttered? Are the exam rooms clean? How do the bathrooms look? How is the lighting? How is our presentation in terms of, the attire that we're wearing, right? What music is playing in the background? How are we answering the phones with patients present in the clinic? These are all little things that are really, really important to focus on inside of the practice. Cost per lead. This is something that we focus on in our program quite a lot. So it's the average cost that you pay to generate an inquiry, a lead, or a referral from different marketing activities. It's the branding and networking, quality marketing. And this is why we ask for images, why we ask for videos, why we ask for those assets so often. This has an impact on our ability to generate more for your practice. So we don't like it obviously to be perceived as anything that we're making work on the team, but it should be an opportunity that everyone in the practice sees as being able to generate more from less. The cost per show. So lead is only the start of the new patient journey. How much you're paying to schedule a patient to show up is really important to know. Our best practices shine and deliver the best ROI by focusing on the cost per show. And that's why we use our scripts, using gratitude and politeness, why we use time and develop that know, like, trust with the patient. So the scripts that you use in the practice may seem to add a minute or two to the overall time that you used to spend with your patient, but it dramatically increases the ability to show, or the show rate overall, which drives down the cost for us to bring a patient into the practice to see the provider. Cost per acquisition is the total amount of to generate for treatment. So this is our primary focus in terms of what we look to do inside of our program. So obviously there's many variables that will impact this cost, but it's why we track everything inside of our Growth Express. At every step in the way, we're looking to optimize the cost that it takes to acquire a patient for a high value treatment. And finally, the patient lifetime value, we don't want to just stop at only the treatment, but we want to look at the entire process of that treatment. So what is the completion value of that patient? So when you receive the revenue from a lifetime experience of the patient, you're really helping that patient to complete an entire process. This includes your upsells, all of your follow-ups. So in a dental practice, it's going to be, what type of hygiene is it generating in the future? In a vein practice, it's going to be the ultrasounds that are done potentially at 3 months, 6 months, 12 months. All of that adds to referrals, your reviews, patient coming back and acknowledging that they want to continue seeing you for any of the issues that they're going to continue to have. So we always want to consistently increase this number over time, and that obviously has a huge impact on our overall revenue generation. So why do these metrics matter? So here's scenario A. This is a pretty typical what we would see in a 6-figure clinic. And for a lot of practices, they're going to see this is a very good outcome, and that's perfectly fine. But the difference here between a 6-figure clinic and a 7-figure clinic, we'll see in a moment. So here's a cost per lead, about $60 to basically generate a lead for a specific promotion. It's going to cost us about $200 to schedule a patient in. Of the $60 per lead, only 30% of them are going to schedule an appointment. Of those that schedule an appointment, maybe only 50% will show up. And obviously our cost per show is now $400. And by the time we present to the patient and they accept the case, maybe our case acceptance is about 20%. So now what we're looking at is a cost per acquisition or cost per acceptance of $200. If our lifetime value for that patient is $7,500, maybe over a 12 to 18 month period, we're looking at a gross margin of about $4,500, which for most practices would be very happy with. But again, this is the mindset of a 6-figure clinic, not a 7-figure clinic. In our program, the focus is to get you to 7 figures. And by doing that, what we want to do is we want to focus on, in this instance, 2 examples. What happens if we increase the scheduling rate? What happens if we increase the case acceptance overall? In this situation, if we can drive the scheduling rate up from 30% to 45% and take the case acceptance from 20% to 30%, we can see our cost per acquisition drops instead of $2,000 to $890. And this 47%, almost 50% margin difference to $6,610 is what sets apart a 6-figure clinic from a 7-figure clinic. This is really important to focus on. We often, in this instance too, want to increase our show rate. So if we could increase the ability to schedule the patient, if we can increase the show rate at the practice, and we can increase the case acceptance, we're obviously going to be generating a substantial more amount of money. And if we can do this day after day, week after week, month after month, going to lead to that seven-figure growth that your practice is looking for. So in this instance, say we generated 10 new patients for a cost of just under $9,000, the practice would have generated about $66,000 in revenue. And that's exactly what we're pointing to here. If we can do that in a week, a month, over a period of time, you're going to lead to more and more revenue inside the practice. So you can control all of these numbers that we've talked about today. So the speed to lead, how quickly you get back to the patients. This is why we ask you to make those 3 calls in the first 48 hours. We want to make sure that we're calling those leads, we're getting them excited, we're getting them in, we're helping them. We want to use our scripts and techniques that we know are best practice, that are proven in all of our 7-figure clinics. We want to focus on establishing that therapeutic relationship, make the patient feel that they're valued, that they're heard, that we're able to help them. The more you schedule, the more who are going to show, regardless of the show rate. And the more who show equals the more that you're going to treat. And that's the goal, is bringing in the right type of patient, right time, and the right numbers to get you to those 7 figures. And obviously, we're going to continue to ask for more pictures, videos, assets that are going to prove all of these numbers and then work with you and support you in each of these actions, because our team is 100% committed to helping you achieve this. So quick recap. It's important to rewatch this video in the next 5 to 14 days. It's really important to understand the math that's going on inside your practice. We want to take note of the metrics and how you influence them. I'll be working with each of the practices to ensure that we're tracking these numbers and making sure that we're optimizing them. I also want you to change your belief system that each patient is worth that $7,500 in terms of their lifetime value. And that's really going to drive a lot of success inside the practice. And remember that that value of a 5% difference at each step of the process really does influence the overall numbers dramatically. And we're here to help you get better. This is what you're doing the program for. We're really excited that you're here and taking care of everything inside of your practice. And we're really looking forward to you getting to those metrics.